Hello, my name is Mary Park. The topic that I will be talking about is cervical cancer. So, what is a cervical cancer? Cervical cancer is a disease in which cancer cells are found in the tissues of the cervix. The cervix is located on the lower part of the uterus. The cancer cells that actually cause cervical cancer is the human papillomavirus, or also known as HPV. What are the risk factors of the cervical cancer? The most important one is the HPV infection. It spreads from one person to another during skin-to-skin contact. Infection with HPV is very common, and in most people, the body can clear the infection by itself. Sometimes, however, the infection does not go away and becomes chronic. Chronic infection, especially when it's caused by certain high-risk HPV types, can eventually cause cervical cancer. Another risk factor is smoking. Smokers are twice as likely than non-smokers to get cervical cancers. Smoking also makes the immune system less effective in fighting HPV infections. Also, the long-term use of birth control pills can be a risk factor. Research shows that the longer use of oral contraceptive increases the risk, but once the pills are stopped, the risk goes back down. So what are the symptoms of cervical cancer? During the early stage, there may be no signs or no symptoms at all. However, during the later stages, there may be abnormal bleeding, discharge from the vagina, or pain during sex. The diagram below shows the different stages of the uterus as cancer cells grow in the cervix. So what are the treatments for cervical cancer? For the earliest stages of cervical cancer, either surgery or radiation combined with chemo may be used. For later stages, radiation combined with chemo is usually the main treatment. Chemo by itself is often used to treat advanced cervical cancer. Surgery is when doctors remove cancer tissue in an operation. Chemotherapy is when they use special medicine to shrink or kill the cancer. Radiation therapy is when they use high energy rays to kill the cancer. How can cervical cancer be prevented? It can be prevented through a Pap test, which is a procedure used to collect cells from the cervix so they can be looked under a microscope to find cancer or precancer cells. Women should have their first Pap test at the age of 21. Another preventing method is the HPV vaccines. There are two vaccines, Cervarix and the Gardasil. The vaccines work best when given before a person's first sexual contact, when she could be exposed to HPV. Both vaccines are recommended for 11 and 12-year-old girls, but the vaccines also can be used in girls as young as 9 and in women through age 26 who did not get any or all of the shots when they were younger. These are the statistics of cervical cancer. According to the Centers for Disease Control and Prevention, more Black and Hispanic women get cervical cancer than women of other race or ethnicities. The graph on the left shows age-adjusted incidence rates for cervical cancer in the U.S. during 2004 and 2008. About 10 Black women, 7 white women, 7 American Indian, Alaska Native women, and 7 Asian Pacific Islander women were diagnosed with cervical cancer per 100,000 women. The graph on the right shows a longer period of incidence rates from 1999 to 2011. It still shows that Hispanic and Black women had the highest rate of getting cervical cancer. But the good news is, cervical cancer is the easiest cancer to prevent. Thank you for watching my video. Have a great day.